from 90% to about 50%. And on agriculture, there have been increased food security due to development of FIVIMs, early warning systems, and extension of services such as provision of inputs, livestock vaccination, and disease and surveillance. And there have been an increasement in productivity.
The other team, welcome.
Thank you. My name is Kennedy Otia. I would like to oppose what you have just said on the point of infrastructure in Turkana as the infrastructure in Nairobi. When you consider, if you are going to weigh the infrastructure around the northern Kenya and the Nairobi region, sincerely speaking, you cannot compare those counties. Infrastructure in Nairobi is more advanced. We have just talked of Nairobi-Kitale Highway. That is in the other region. We have not talked of Turkana Baby, or the northeastern, and the counties involved. Secondly, is on the matter of inefficiency. My friend just said that Turkana is allocated more budget than Nairobi County. Yes, that's true. Then, my question is, why can't Turkana be more advanced than Nairobi? Why can't the Turkana County reach the point of where the Nairobi County has been? Thank you.
And I'm here to react on the point of what power political clashes they raised. You give an example of the deputy president, and like to ask them, if the evolution is not about power sharing, what if there be clashes? The other day, if there's no revolution, there will be a concentration of service delivered to the common citizen. If the revolution is there, then it will bring about power fighting, to bring about corruption. That's why we hear about some people are being impeached and they don't give the offices. Then the other point I'll talk about, it's about the priest about health. I've heard our opponent, one of our opponents come from health department. I just want to pose a question. How many times health people on the sick? Thank you.
Yeah, thank you so much for your presentation. We appreciate so much. We are going to give you the results after this to tell you as one so that we can move to the next. So now we are going to have the next presenters. Who are the
Wakili versus Tharaka University Group 2. University on the other side.
Yes. So they choose who to. Tharaka, do you want to toast? Because the other time University of Chuka. Let up Tharaka now toasting. Toast na mjue sasa head, automatically it is there. Vile itaanguka, the Chuka has no choice, or take the other side. So ikianguka ikiwa juu head, you just know your proposers. Mchama yule anakuanga na good luck. Yule aliomba asubuhi. If you didn't pray in the morning, atakuangusha tafadhali. Kama mko na pasta within you, the best, yeah, you can do the toasting. Head, yes. So you are the proposers, and then Chuka become the opposers. The wakilis are the opposers. As they organize themselves, people can give you the question, 1 second to think about it, and then for the judges, that will come here and hear as they think about the topic.
This is what we'll be debating on. Has CBC been properly adopted into Kenya's education system, or should it be restructured? One more time. Has CBC been properly adopted into Kenya's education system, or should it be restructured? Very good. Start now. So we give each side a minute to introduce yourselves. But even when you come to make your presentation, you can just say your first name so that we can remember. So a minute each to introduce yourselves, starting the proposers. A minute each, all of you. A minute. Just your names. Start with the proposers.
Good afternoon, everyone.
Yes, I'm Clinton Odhiambo. I'm pursuing Bachelor of Arts in Economics and Sociology. I'm a fourth-year student.
Charlene Jagi, pursuing Bachelor of Arts, Maths, Economics.
Joseph John, Economics and Statistics, for the year.
Hello, Lucy Modani, second year.
Good afternoon, everybody. I'm Lily Stumavi, pursuing Bachelor of Science in Economics and Statistics, a fourth-year student.
Matthias Simoni, a fourth year, pursuing Bachelor of Science in Economics and Statistics. Matthias Simoni.
Good afternoon, everyone. I'm Cliff Rusana, a law student, 1.2.
Good afternoon. I'm Grace Kirichu, first year law student.
Good afternoon. I'm Deborah Jericho, first year law student.
Good afternoon. My name is Patience Nanjala, I'm a law student.
Good afternoon. Zakaria Maina, a law student, first year.
The proposers, 5 minutes.
Okay, good afternoon once again. I'm Clinton Odhiambo, and thank you for this opportunity to propose this motion of today that says, that asks whether CBC has properly adopted, whether CBC properly adopted, has been adopted properly in the Kenyan education system. So I will start by recognizing the importance of why CBC was brought into board. You see, since independence, we've added a number of various education models, but then these education models were not were more of exam-based. They were not student-based models. So in 2019, to be specific, the government of Kenya, through the Ministry of Education, adopted the CBC by our late Professor Magoha, and I will go directly to its importance. Yes, I will subscribe to say that CBC up to this far, the government has been trying to implement it, and one of the reasons that make it so vital and that we give it time so that we stop criticizing it is, number one, CBC identifies early and nurtures the talent of the learners, as opposed to the various models like 844 that we've been having, which was not recognizing the talents of learners. So you find like 844 is focusing more on academics, and that is what they were awarded. And the talents like drama, sports, games, those ones were not recognized. So you find a student who is not able to perform well in academics, is not able to be, but is well in talent, is not being recognized and is going and rewarded. And by the end of the day, you find their life going to retrograde later. And secondly, is that CBC focuses on practical skills, not just exams. You find that the skills that are being calculated to the learners of CBC, like for instance the digital and technology skills, are of great importance, unlike the 844, which was not incorporating that. And also CBC has also helped in equipping the learners with the skills of entrepreneurship, innovation, creativity, which enable them to initiate various projects which help them in generating income even as early as the time that they are still learning in school. So I will give the time for the second proposal.
The next point is CBC have increased parental and teachers' involvement. This is because it focuses mostly on competence and not academically, and also increased parental teachers' involvement is crucial for child development. Thank you.
Charlene, I'm here to propose that CBC, which has been already properly adopted and it should not be restructured. CBC prepares learners for jobs and self-employment. You get that a CBC student who has started learning from class 4, 5, or 6, in that he or she is able to tailor, in that if he or she gets out of the school immediately after class 8, she can be able to own her own tailoring shop or business. Yeah, and in that they have also been equipped with digital and technological skills, and so they can be able even to operate these computers, which you get that as who are used to 844. Some of us live after Form 4, then we go to take a computer classes. We go to take computer classes, unlike them. So they are better, and I'm here to say it will never be distracted.
You have 9 seconds.
CBC.
For the purposes of record, I'm Zakaria Maina. Honorable judges have been invited on this dais to oppose the motion that whether CBC has been properly adopted. Allow me to handle this issue under one ground, that is curriculum complexity. Under this curriculum complexity, I'm going to handle it under 2 factors, that is content overload and the assessment method. Under the content overload, we can say that the content that these students are learning is overload. It's more than their age. For example, this grade 6 student doing 9 subjects, and these 9 subjects, there is set books, there are practicals, which he or she needs to understand, And yet, these set books, a high school student used to find it hard to read. How can you tell us that a grade 6 student will find it simple to understand them? Now, the second issue is the assessment method. The method used to assess this student, it's more complexity. Why? You find that these students are given that it's not like the traditional form that we used to do, the ABCD, which was more simpler. If you take a normal example, that's the normal assessment. A student could guess answers, and if he or she is correct. Then, when it comes to CBC, these students are given a copy, a paper, an exam to write what they have. This seems that those students who are bright are more capable of passing the exam. Let's leave in the other students who are on an average level, leaving them behind. Allow me to invite my co-debater to handle the second issue. Thank you very much.
Thank you, Honorable Judges. My name is Grace Kirutu. I'd like to continue from where my co-debater has left. I'd love to still oppose on the motion that CBC has not been properly adopted into this country. This is because you'll find that there are inadequate facilities in the country. You'll find that in most constituencies and in most counties, you'll find that there is no proper enough classrooms for these students to study in, or laboratories, because CBC requires a lot of science laboratories for the specific in the specific curriculum. You'll find that there are no adequate facilities to provide for students to be able to learn whatever they need to learn. I'd also like to also add that there is also high cost that is suffered among the parents, because the KICD, the Kenya Institute of Curriculum Development, will produce this is the whatever we need for example, the set books, the books that you need, and then there are so many subjects to be learned, and the parents need to buy all these textbooks and the exercise books, because the government may not be able to actually raise all this amount of everything they actually need, or the equipment in the labs, it is really a huge burden to the students, which is why you find that most parents prefer to take their children to private schools, but yet public schools are not able to cater for what is needed. Yet the common Mwananchi is not able to afford the private schools. I'd also like to add on poor training. You'll find that, for example, a student in grade 8, grade 9 is learning things like molds, things used to learn in high school, and then the teachers are not even adequately prepared or taught to teach such kind of things in schools. So there is no proper training for these teachers, for the JSS teachers, which is why I'd like to really strongly oppose that CBC has been properly adopted into this country. Thank you for your time.
So, honorable judges, audience, my name is Cliff Otieno Lusana. I would like to move on to the last thing, and I would like to oppose that, as my co-debater Grace Grit was said, modally you will find that the teachers that are supposed to take the CBC student through their subjects are the same teachers who gone through the training of the TVETs. Here, you will find a teacher who is used to singing in class 2, singing with a child, Baby Lala, like for example, the Baby Lala song is now being expected to teach a child something that I personally, as Councillor Rusana, I was taught in Form 4, something like the bonds and the articulations of the bonds. You see, the teachers doesn't have enough content so that they may deliver what is expected of them to the CBC students. Then lastly, I would like to say that the CBC thing is putting much burden on the parents.
The first round is over.
Thank you, honorable judges.
We are giving you now 3 minutes each to react to the points of the opponents.
Good evening. I'm Joseph. I'm hereby planning to react on the point of high cost. Yes, it is costly, but the government has subsidized the education, and it has budgeted 123.3 billion in the supplementary budget. 8 billion to construct classrooms, 10,000 classrooms. So, whatever you talk of, issue of costs, already you are subsidized to undertake this program. About high training and poor training, I think my friend is somehow not capturing it well, that here, the GSS, there is what we call on-job training. When something is new and you're educated university student, you're able to integrate it first and bring it to the board. On that sector, we don't need to read parts of arthropoda, classes of biology, those things. We need to go to technology and innovate. So, going back to reading parts of an antelope, it is not viable. Lastly, it's about the workload. You see, CBC, it is 2633 system, whereby it is able to bring up the brightest. And the bright minds are the ones which change the nation. The issue of copying will be put down. As my friend has said that it is tiresome and is bringing confusion, copying ABCD. Now it is not much copying, it is proving you know. Thank you.
Thank you so much. I want to react on the point about content overload. One you should know about that CBC is skilled based because number one, you should understand that knowledge without skills, then it becomes useless. Number two, it is about assessment. When you talk about parents, when we talk about parents, teachers being engaged in this assessment, that is one key principle of good governance, because they will ensure transparency and efficient in everything that their children are doing. The other thing is about cost. Yes, the education on CBC is costly, but we need to understand that it is a long-term. It is a long-term educational improvement, whereby you need to understand that we cannot something that is.
Thank you. It's time.
Thank you.
Thank you for this time. Once again, for the purposes of record, my name is Patience Nanjala. I really, really appreciate what the proposer has said, that the CBC is costly. Thank you for coming to my side, by the way. Indeed, it is costly. But then, we have, telling by the economic situations that are facing us in our country, we need to be able to save costs as much as possible. There are so many sectors in our country which are very, very vital. Now, when it comes to us already draining all the funds in our country into one sector, it is not right. When it comes to the CBC, why have this curriculum that is so expensive, yet we can save cost and be able to build sectors such as hospitals? We can also build other things and be able to allocate these funds in the manner that is at least reasonable. Number two is about parental involvement. When you tell me about parental involvement, I prefer when you say that a parental involvement that is trying to ensure that the parent and the child are trying to know one another better and be able to strengthen the bonds between them. The parental involvement that is in CBC is a parental involvement where the parent is so stressed about the child because each and every day the child will always come home wanting something to be bought. Mom, we need to buy this. Mom, we need to buy that. And that is unfair. That is wrong. We need a curriculum that, if at all we're talking of parental involvement, we're talking of how parents and children will bond with one another better. Thank you.
For the purpose of record, I'm Deborah Jerita. I'd like to rebut on the question on the proposers who propose that the CBC has helped students more in computer learning. In as much as CBC has helped students in computer learning, it has a negative impact in that the students tend to rely more on AI, these computers, rather than critical thinking. Thank you.
For pass of record again, I'm Cliff Usana. I would like to rebut once again. The second, my co-debater here on the proposing side, the second debater said that that the CBC is trying to deal out with the bright student to pull out the result to help the nation. So I want to ask him a question. Those who will not meet the average, where will they go to? Will they be there to steal from those who have proceeded with the CBC thing? Where are they going to with them? Then the second thing, indeed he has said that the education is costly. There is no way the government can only build a classroom, So do they only learn in the classroom? The classroom stack is enough for the learning of the CBC. They need some other resources apart from the classroom, which is just a structure that provides them with shelter. Apart from shelter, they need other things. Thank you.
Thank you so much for your points. We have listened to you. We really appreciate your contribution. We are also learning and we are happy. We are now going to give the next presenters. Thank you so much. A clap for them, please. Geography students and the Haraka 23. ama ni watu wa Tharaka unataka kutoast? Wanasema they don't agree. They have said that they don't mind. So you take the side that will not be chosen. The one is down. Sio? Ile itakuwa down ndio yenu, ile itakuwa juu ni ya hao wanatoa. Can we have the coin?
The proposals will be on this side. The proposals will be on the other side.
Yeah, ili tujue vizuri. Yeah, the coin. Ni wewe unafanya vile utataka, ukitaka kujipima, lakini uivushe kabisa, usifanye vile itakuwa unataka side gani. Umekuwa nini? Head. Mbona every time ni head? You are the proposers, you are the opposers. So that's automatically, because these are proposers, automatically you become opposers. Serious? And you are comfortable. There is no choice because now you decided to take the other side. Can we have now introductions? The topic kwanza that we discuss a bit.
So this is the topic we'll be debating on. Is the Kenyan government effectively managing public health crises like cancer and HIV/AIDS? Is the Kenyan government effectively managing public health crises like cancer and HIV/AIDS? We are good? So you can take a moment. 1 minute.
now so that we can start. The proposers, you can introduce yourselves.
Shalom, brothers and sisters. My name is Silvio Lingewa. I'm pursuing Bachelor of Arts. I'm in the Faculty of Humanities and Social Sciences, doing psychology. Thank you.
Say the names. You have very complex names.
So once again, my name is Silvio Lengewa. Thank you.
Hello, I'm Ivy Precious from the School of Nursing, first year.
Good afternoon, everyone. My name is Odipo Melchizedek Ouma. I'm a fourth year, Economics and Geography.
Good afternoon, intellects. I am Enyaman Naitaki, the Faculty of Education, Mathematics and Geography.
All the protocols observed. Wanyama Wile Samuel, a fourth year student, Faculty of Humanities and Social Sciences.
Good afternoon, I am Lewis Minor, Actuarial Science.
Hello everyone, I'm Helen Rarin from Baraka University, a fourth year student pursuing Bachelor of Arts in Sociology and Religion.
Good afternoon, I'm Anne Mukami, Baraka University, first year student taking Bachelor of Arts, Math and Economics.
Hello everyone, I'm Ouma Collins, Economics and Statistics. Thank you.
Good afternoon, I'm Mugheni Bonfils, Bachelor of Arts, Mathematics and Economics. Thank you.
Good afternoon, I'm Angela Wenjimu, taking Bachelor of Science in Economics and Statistics.
Shalom, brothers and sisters. I'm Onyango Monica, a statistician.
God bless you all. So I start, and by giving a practical example, I want to draw your attention to this one thing, that an example of a country of people that was given good governance is
How then, you may ask? Testing and counseling in the great nation of Kenya is free. You get free testing, free ARVs, free medications, and in case you end up having TB, the tablets are still free. That is how much our country is investing in our health, so that our citizens in every manner can ensure are healthy and well taken care of. Other than that, the country has invested greatly in prevention programs. Most of you have read books. You have read broken passages, even in high school, primary schools, irregardless. You have read stories in your textbooks telling you on how you can prevent yourself from getting maybe HIV contractions. Ladies and gentlemen, HIV is an entire science topic in grade 6 in our great nation. If that's not a government trying, then there's not a government in the world trying. Our government has also has had early tests, protection for breast cancer, right? Last year, the government of Kenya did go out and say that every 12-year-old was to be tested not only for breast cancer, also cervical cancer. Ladies and gentlemen, that is a trying country.
Thank you so much, my sister, for being here once again. I want to propose that the government of Kenya has done extremely great in managing public health crises like cancer and HIV and AIDS. A good example is now the elimination of the defunct NHIF and the introduction of SHA, the Social Health Authority. The Social Health Authority caters for 400,000 Kenyan shillings of cancer treatment. And under the under cancer treatment, we have the 138,207 for chemotherapy. For surgery, the 128,207, and for radiotherapy, it is 119,036 Kenyan shillings. A total of 333,462 Kenyan shillings. That is a bigger percentage of the cancer treatment involved. And again, the government of Kenya has allocated a lot of funds in the health sector. You compare the 2024-2025 allocation to that in 2023-2024. In the year 2023-2024, it was 138 billion. 2024-2025, it's 147 billion. That is a great improvement in the health sector. And again, as economists, I do believe that we are the implementers of policies that enable proper utilization of the scarce resources that we have. And as you and I know, money is a scarce resource. And I believe some of you must have read.
Thank you. It's time.
Sorry.
So once again, I'm Helen, and I'm here to strongly oppose the view that the Kenyan government is effective in the management of public health issues, that is HIV and AIDS and cancer. The Kenyan government is not effective at all. Since the inception of the beginning of HIV and AIDS and cancer in 1980s and 1990s, the rates of cancer and HIV have increased rapidly. It started at a rate of 15% in the Nyanza region, and now the amount of people receiving HIV and retrovirus is 1.5 million Kenyan people, with a rate of death rates 23,000 reported cases in 2023 of people dying with HIV and AIDS. Cancer, we are, and in Kenya, we are at a very high risk of death from cancer. 33,000 people reported according to Kenyan statistics in 2019. So that is a total amount of 56,000. We are losing taxes, we are losing a labor force, and now the Kenyan government is not effective at all. Why? Because in resources allocation, the government of Kenya, there is inefficiency in resources allocation. Compared rural and urban areas, you find like in areas like Nairobi, those HIV services are available, but go to the rural areas, the case is different. The amount of people receiving those antiretroviral therapy is quite low. There is no awareness, so those people, they lack education for them to know that they have to access those health services. In addition, the Kenyan government, there is insufficient infrastructure. According to the United States for International Development, there is a high rate of 40% of the Kenyan rural population are affected by breast cancer, which is at a high rate of 24% of women Kenyans who are diagnosed of cancer. Those women go to rural areas, not even in rural areas. I'm very sure even in the Kenyan referral hospital, not all national or big hospitals have those big facilities for screening cancer and the rest. The case yesterday, just 3 days ago, we had very many health issues like the Kajiado Referral Hospital. We are hearing a lot of nurse strike, doctor strike. So if Kenya is not able to manage a simple issue of malaria, how is Kenya even able to manage a pandemic that is now almost 15 and above years since inception? What we rely is a lot of foreign donors. And now, due to the merciless president of the United States, which is Donald Trump, the subsidies that we used to receive, even those ARVs, we don't, as Kenyans, we don't buy. We rely on donation. Now we are at high risk. That man, Donald Trump, have already terminated the issue. So as Kenyans, additionally, the Kenyan government, there is a lot of unemployment rates. At overall, 5.7% of the Kenyan are unemployed. So imagine the rate, and imagine those who are affected by HIV and AIDS are sex workers and drug users. Sex workers are 27% and drugs users at 18%. So imagine someone entering into a sex work because of lack of employment. How is that person able to access a health facility, or even how is that person able to go to a health center for cancer screening, or even get a board, export herself to India to get a proper treatment? So the government of Kenya is not effective enough.
I'm Anne, and I'm here to oppose the motion. And my first point is governance and accountability issues. The government is providing the funds to fund the HIV and the cancer victims, but they are not being accountable about the funds. For example, in 2018, the scandal of misappropriation of funds intended for HIV and AIDS programs. This means that the funds that was supposed to be for HIV and AIDS was used for other purposes, for maybe the people who are supposed to be accountable for it were not being accountable, and they used it for other purposes that were not meant for HIV and cancer victims. The second point is about data management of research. We have
proposers, step.
Yeah, we are now going to give you each 3 minutes to react.
Good afternoon again. I would like to bring to the attention of Ms. Atieno that she's arguing that the government has not done enough to cater for health regarding HIV and AIDS, but it's so unfortunate that you cannot acknowledge the in place to ensure that today more screening is being done than it was done 10 years ago, and it is evident that HIV-related deaths have been declined and the life expectancy has improved. So I would like to welcome you, to invite you that we measure progress by outcome and not imperfection. Thank you.
I'm Wanyama, and categorically not running away from the addressing the elephant in the room. Kindly, I want to argue my best point in this way. My sister said, in Kenya right now, the government has failed to put in position in order policies that can help to make people get access health services. But the thing is, how can you expect, for example, SHA, people are so many complaining in different parts of Kenya. It has just been implemented the other day, but you want to be working all over the country. Which miracle can happen? Can you pray to them tomorrow that I will pray for the rain, tomorrow the rain starts to rain? Really, everything starts a bit by bit. There is no way something you can implement it today and you expect it to start working tomorrow. Thank you so much.
Yeah, thank you. I am Enyaman Naitaki. I would like to ask my fellows, by disregarding the Kenya's medical system and saying that we cannot handle small cases like malaria, kindly explain to me how we were able to host the late Magufuli in our own Kenyatta National Hospital. And also, on consideration to that, we are progressing as a country and we are medically improving our services. So how do you want to tell me that the same systems we are using right now is the same as those we were using long ago, and telling us that our diagnosis systems is actually failing? It does not make sense. And telling us that according to research, our numbers are dwindling according to the number of cases we are handling in terms of HIV and cancer. It is wrong, because as a study shows, SARNA shows that 61% of our HIV cases has actually gone down. This makes Kenya rank number 3 in Africa in terms of how they are managing the HIV cases and cancer. And to make it clear to you, cancer screening does not require big machines. I don't know by definition what do you want us to use to screen for cancer. In fact, funny enough, we have testing kits that can be bought at the closest shops, chemists, beside your places. So how is it impossible for us to detect these diseases? Thank you.
Okay, I'm Monica. I'll start by saying that when you talk about government being effective in providing the facilities for health, have you heard of a great prominent leader, let's talk about the president himself, dying in Kenya of a cancer? You will hear them like he's from US, he's from other countries, then he went outside Kenya to get treated. So if we had those machines, if we had those equipments, then perhaps they could have been here in Kenya getting treated. Because even in Kenyatta National Hospital, I think you can't even compare it to Uganda, hospital in Uganda, hospital in Tanzania. So we should be the best. That means our president should not go outside to get treated. Then when you talk about SHA, being active in curing HIV and cancer, I think HIV, most of them are outpatient, but SHA is an inpatient. So how? SHA is dealing with inpatient. For outpatient, with inpatient. For outpatient, we have to pay. So most of HIV cases are outpatient. So how is it helping in delivering services in health sectors? Thank you.
Hello everyone, once again, for the sake of record, I'm Ouma Collins. I have two questions to the opposing side. Number one, you have talked of free medical care. The other day, I visited our nearest dispensary, and then the medication that I was given were mainly painkillers. So, and then the other medication I was told to go and buy from the pharmacies. May you elaborate how free medication is in Kenya? And then, can you please elaborate the effectiveness of SHA? And how will it be implemented? And then the other day, when the president of US, Trump, freeze the aid, can you tell us where were the over 5.2 billion Kenya shillings that are meant for cancer and HIV? Where were these money going to before the freeze? Thank you.
Thank you, it's time.
Thank you so much. Can we have a clap again, please? Thank you for the presentation. We have really listened to you. In fact, I'm seeing good policy makers ahead. Thank you so much. Can you now go back? The judges, we want to meet out there as the MC take over.
We, hebu mtu aseme we. Mambo imefanya nini? Imeboilo. Karibuni sana. Watu. Hebu ukiangalia debate hapa muangalie pulse rate yake. Asikuwa anakimbiza damu huko alafu imwage yote. Basi wanatisha hadi na Kizungu anasema for the renewal of record, for the sake of record. Alafu anatuchocha, si ndio? Mimi kuna acha watu wachana na watu wa debate. Kuna veleshi hiyo 20 bomb Iko wapi kwanza? Wameiokota, walikuwa wameiacha hapa. Kuna vile wanaitoss. Ni kama aje? Ni kama wanataka itupo wakaisomea huku nje. Wachana na wao wa mwisho na wachana kwa hao katikati. Walitupa hiyo 20 bob. Kama wako na hasira, ikaenda kusimama huko.
Unajua hiyo ni sapa ya mtu siku mbili.
I know. Na wanatupa 20 bob hivyo mnaiacha huku ile
Kimalizia tafadhali mnaweza nipea.
Hii 20 bob. Ndio hiyo 20 bob. Acha niwashikie hivi. Nitaitisha na nini na judges wakitaka kutosi. Oh, ni economist. Mtaniitisha. Si niwashikie, si ndio? Si mnarudi hii debaters. Mtaniitisha 20 bob. Hamwezi kuwa mnaweka 20 bob hapa inakaa hivi hivi. You know what 20 shilling is? Wewe unatafanya nini 20 shillings? Budget your 20 shillings.
Inaweza kula nini hiyo? Usukuma. Ya alafu ongeze na kakitu juu.
Iko na avocado, si ndio? Iko na avocado. Si ndio? Wacha sasa hizi kwanza hii ni maembe 4 hii. Hii ni maembe 4 tano ukinunua hapa Gate huyo mama wa hapa Gate anaongezea hapa.
Lakini si ati tunampigia biashara, tunasema tu kweli.
Yeah, ukienda na 20 bob kwa huyo madhe akakuongezea moja. But this is a lot of money. Mkitupa hii 20 bob, mnaiokota, mnaiekelea hata kudharau 20 shillings.
Alafu mnikaa bibi. Unajua kuna watu wamekaa chini sinzo kuja eat. Like hawajatoka kwa hizo vitu zao. Like hawako si debaters, si dancer,
na si MC,
na si lecturer. Yo. Si msimame tu for 5 seconds at least hata kiti tulie.
Simameni pembeni,
tusimame tu kidogo, tusimame kidogo. Jo kuna watu washafika.
Watu wa Tharaka mlitengenezewa barabara. Tuliacha kama hawana barabara, mlitengenezewa barabara.
Na kunanyesha.
Bado. Na mna propose ama mna oppose hapa? Mna oppose.
Kaili hebu tusimame for 1 minute, tusimame hata stretch. Tusimame jamani, wana ndugu na wanadada. Wa? Thank you. Hebu tusimame kidogo, unyoroshe miguu, unyoroshe mikono as we wait for finals.
Kuna debate nimeona hapo Chuo University na sijai muona mrefu hivi vizuri. Amejiita nani? Cliff. Umeona Cliff? Mwenye alikuwa anasema nini hapo hapo Cliff? Ameenda kunywa chai. Cliff hapo pale. Cliff, tumekusikia wewe ubebe moja hapa, sawa? Ubebe moja hapa uko mzuri na sijakuona wewe huu. Ama wewe ni wa Tharaka? Wewe ni huko kwenye kuna barabara? Nataka tufanye warm up kiasi. Let us stand up.
DJ.
Unataka tudani?
Unaweza onyesha styles. Mimi ndakuwa na wa height.
Sawa. Are we standing? Jamani tusimameni. Tusimameni ndio tusikule time mingi sana. To dance bazokigo kidogo.
Tusimame kidogo. Yaani hauchoki kukaa for like 8, 9, 5 hours. Na baada ya kusaidie
kidogo. Tafadhali. Hata kama ni wawili.
Danza mmoja akuja aonyeshe nini hapa hivi style.
Tusaidie
like 1 minute tuchangamke, then to move to another thing.
Danza ama mimi mwenyewe ni wadansishe, sawa? DJ nipatie.
Kuna
okay, hii ni kuku dance. Mimi najua kuku dance. Najua kuku dance kuja kusaidie. So tunaweza kuwa na kopi pia mimi. Jehova. Nani anajua kuku dance? Danza anajua kuku dance. Hizi ni kuku dance. Mimi ndo nini? Kuku.
Ngoja Monica. Nikaa watu wataki kudance, mnaweza keti sasa basi. Mnataka kudance? Sawa. Basi mtu mmoja wa ni wa push.
Kachu. Tunaweza piga makofi wakikuja.
Kachu, mtu mmoja wa Kachu kuja utuonyesha hapo
moves.
Dance deadly, watu wa dance wachangamke kidogo.
Na pia mimi niko.
Tukingoja for the purpose of records warudi.
Hawezi kataa ni madansa. So nataka kupigia hapo. DJ wapatie wimbo. Oh hiyo.
Na mchukue notes.
Unadanganyishwa.
Wakidance na response.
Beriki yako yote.
Makofi yao. Hata watu wa changamsho shaketi. Waheshimiwa. Protocols observed. Kama protocols already set. Mshaketi. Ni sawa.
Acha niwaonyeshe kitu fulani tutafanya. Nikisema one, nikisema nini? Watu, nikisema one unainua mkono yako unainua kidole yako moja hivi. Sawa sawa? Are we speaking? Nikisema tu unafunika kidole ya mwenzako. Sawa sawa? Nikisema 3 unashika hiyo kidole ilikuwa imeinuliwa. Are we together? Haya tufanye na Mary muone. Nikisema 1 unainua kidole moja hivi, hebu mtu ainue kidole yake hivi. Haya, nikisema tu unafunika ya mwenzako yenye imeinuliwa mwenye kwa kando yako. Ainue, simeka hivi, huyo ainue, wewe umfunike, hivyo. 1 is this, 2 is this. Na hiyo mkono ingine exactly. Hivyo sasa. Usikume inua vidole zako zote mbili jameni. You lift one finger, the other finger is ya kufunikia. Are we there? Let's do number 1. Tuinue mkono gani, right ama left? Right. Kidole moja, kidole ni ya right, kufunika ni left. Sawa sawa? Haya, waninua kidole yako ya right moja. Na uinue kidole iko na adabu jameni, Usinue kidole inaleta aibu. Iko haina devolution. Haya, 1 mkono ya right. Haya, alafu 2 unafunika hiyo kidole. Jameni sioni mkifunika vidole jameni. Haya, number 3 unashika hiyo kidole. Sawa sawa? So the goal is kukosa kushikwa kidole. Sawa sawa? You make sure kidole yako ijashikwa. Sawa sawa? Msinichekele. Haya, number 1. Haya, number 2. Mbona nyinyi hamshikani vidole? Unajua Mungu alikupatia vidole 10 na utaki kuinua moja. Nianza kwa guilt trip. Kama uko na kidole yako, umevuka barabara mingi, kidole yako itakanyangwa na gari. Umekatakata sukuma na vitunguu, hujaikata hiyo kidole na unakataa kuinua. Hiyo ni makosha. Haya, number 1, lift your right hand finger. Number 2. Haya, number 3. Haya, number 1 again. Mimi na mimi nifunike. Okay. Number 1. Haya, number 2. Number 3. Yes. Nyinyi watu wa mko focus na nyinyi economists. Haya, number 1 again. Number 2. Number 3. Ni sawa sawa. Nataka tuite poets. Nani alikuwa anafanyaga mashairi akiwa high school? Who was used to do mashairi akiwa high school? Mary, ushaifanya poem kwa life yako?
Yeah.
Mtu anaanzanga aje poem?
Nilifanya nikiwa poem.
It is well, unaweza kumbuka tu.
Yini wakasema daraja moja.
Hiyo ni shairi.
Si poem mashairi Kiswahili na English tafadhali.
Okay, sasa tunataka kufanya English.
In front of you, it's me again. When I was young, I was young. Now that I'm old. Yeah.
Ndio mistari. Mimi niseme poem. Niseme poem watu.
Sema.
Si poem lazima ikuwe na rhyme scheme, si ndio? Na ikuwe na alliteration na consonant.
Na pia persona.
Na persona na theme. So this is my poem. Our adjudicators, teachers, parents, and all my fellow congregation, in front of you is Monica, ready to present to you with a poem entitled Devolution is Restoration. Entitled Devolution is Restoration. So sit back, jiggy your shirts, and enjoy. Devolution is restoration. Why wouldn't it be manifestation? Because when you see all allegations, they have been made, and all of them have run down to the drain of alliteration. The president said, "Can't you see what I did?" Yes, you can clap for me. Yeah, I'm a creative. See, that's nice. And so I want us to invite the poet. Sijui kama ako around. Is that guy around? He is here. He is Bwana Wanyama. He is Bwana who? Mnamkumbuka yule mwenye alituambia alisema nini? Alisema hiki tu. Policy inaitwa, tuliambia policy inaitwa jina Kiswahili. Sarah. You remember the guy who said Sarah? Mnakumbuka Bwana Sarah?
Mkumbuka.
Mnamkumbuka. Haya, acha basi akuje atuambie kama lunch inaiva. Wewe mbona hawa watu wamebonda hivi?
Sijui.
Hapana, nimejua.
Alafu najua.
Nimejua.
Profession hiyo wanafanya. Ati? Wanafanya na doubt profession hiyo.
Nimejua. Niseme ni nini?
Sema.
Ni poto. Nyinyi mnakataa kusoma, mnachekelea walimu wakipigiwa kelele hapa na hamsomi, poto imekuja inawashtua. Kai. Hata msicheke. Msicheke. There is nothing funny. There is nothing funny in this life, baby.
Yeah, very. Okay, poto ndio imefanya mmebondeka, imewafinyanga.
Vile mnakaa serious kumbe hamsomi. Watu wa economics, kazi hii ni kujipanga tu debate. Debate after debate. Mnasema hata siku hizi tuna debate mahali sisi. Sisi tunasoma. Sasa ona nyinyi mgoma na poto.
Usiingilie watu wa economics.
Hapana.
Awe mtu wa psychology mtu wa brain. Kwani uko kumekuwa aje?
Kwangu ni kuzuri. Mambo iko shwari.
Unajua kuna different between wewe kufurahia portal na kuna portal inasema aje. Wewe portal inasema aje, opinion yako.
Happiness is relative. Now mimi happiness yangu is not externally, is not external. Maybe I have my own happiness. Wewe kama ni mtu kufurahishwa na poto ndio wewe unalalamika, unasikia kulia. By the you can rub the back of your neighbor. Yeah. It is very necessary.
Wa comfort.
Kuna mtu anasikia tu anguka hapo hivi.
Mtu achuka kijamani, hata kama wewe ni mtu wa Tharaka na uko karibu na mtu achuka, hebu murabu
poto za Tharaka pia
poto ni siku nzuri. Wakati ukitoka mgomo immediately exam, immediately cuts. Tunaelewa masaibu mliopitia. Sasa jamani,
kwanza watu wa Tharaka, kwanza wakaitwa campus, wakafikiria wameitwa main campus, wakatupwa mashambani, wakakuwa na depression, wanashangaa sasa wataweza kusoma aje? Kidogo wanajaribu kusoma, watu inafunguka. Watu wa Tharaka, hakuna barabara. Oye, watu wa Tharaka. Jua iko huko tititi. Inawafanya wakuwe weupe pepepe. Watu wa Tharaka.
Watu wa Tharaka mnahitaji stima ama
mnatumia sola?
Ama
jua inawakanga hadi usiku. Jua iwaka hadi usiku. Huko ni Tharaka. Wenye hatutaki kufika Tharaka, make it anini. But poleni sana kwa wenye poto limewatenda. Yeah, I wish you all the best next time. Si ndio? Si tunasema hili sasa hivi. Unajua nasema hizo walitoa kama karibu mtihani ikiwa hapo, si ndio? Mnakumbuka? So sasa hivi
sisi uko na 4 weeks ya kusomea.
Sisi uko na 4 weeks. We grieve 2 weeks. Hizo zingine ni za kuwa resilient, si ndio? Hata ukitaka ukufe wewe huwezi kufa kwa sababu uko 24. Unaona? Na hata ukijaribu kujinyonga kama itakatika, kama za siku hizi is legit. So you cannot die, just study, sawa. Yeah. Nawaelewa. I got you. I'll be speaking here. Hata msireact, mubaki hivyo. Naelewa. Pia mimi nishaifail. Sawa. Yes. Hata mimi ndio maana ilifunguka saa ngapi poto?
122.
ilifika tu tukiwa hapa.
Yes.
Amkuwa mmejipanga, si ndio? It's okay.
Najua kuna mwingine sasa hivi ana receive hizi news.
I know. Okay, kuna watu wako wanajua imefunguka.
Ni sisi tumwabreak.
Wakafungua wakapata wamefeel.
Yeah, habari zilizovunjika.
Kama hapo tawiko safi unaweza tusalimia hivi. Madansa poteni iko. Unasomanga saa ngapi nyinyi? Na mnashindaga na ngapi? Ungefanya nyinyi hamwezi kuwa poto. Wanyama kuja.
Kwani side nyingine poto inasema nini?
Watu hapa fanyeni hivi kama poto yenu iko sawa. Yeah, there is one here. Ati nini? Neti kwa chini watu wamejaa huko. Wanang'ang'ana kuingia kufungua poto. Mlango ni moja ya poto. Mtu anaingia moja hata kama ni technology. It is okay. But tutauliza tena si ndio?
Yes. After hii presentation network itakuwa imerudi sawa. Lazima tujue kunasema aje huko.
Mary nasikia ni wanini tukue na moment of silence.
To give respect.
Tufanye a moment of silence. Si ndio? Is it necessary as many as of the opinion of nini silent moment yeah, we can have a silent moment before memory of your 3.1 your 4.1 imeenda hivyo hiyo. Kama ulikuwa unaongoja for mtu wa 1.1 alikuwa anaongoja KCSE huko inakuanga hivyo a moment of silence. Wanyama tuko moment of silence. Na wewe hata sijui poto yako inakaa aje. It is well. Thank you. Thank you. You can clap. You can appreciate me. Unaweza appreciate wanyama. Na usimage content ya debate hapa eh.
So sure. From now, henceforth, 60% of students concentration yao itakuwa 10% kama including me. Ndio watu wengine tumeshinda kufungua portal kuanzia jana hadi saa 6 usiku. Sasa tunajaribu tunaona inaenda kule. Tunaona hivi nini? Inabidi tufunike macho kwanza. In that one aside, portal nitakana ufungue kama umepika ugali. Malu ya niko na omena, kitaka omena niko na. Si ya kuuza. Dogo. Kule ndio upate nafasi ya kufungua portal ukisoma. Okay, that one aside. I go by the name Wanyama, and I'm just trying to take myself back when I was in high school. Unajua mimi nilikuwa kipi. High school, primary, nilikuwa kipi. Nimekuja tu university hapa ndo nikaa. Naona kitambi nitakuja nikaa na road. So that's why I'm realizing myself now I'm growing. So I want to take myself when I was in class 4. Kuna kitabu kilikuwa kinaitwa Kiswahili Kitukuzwe, si ndio? Page number 37. Kuna shairi fulani tulikuwa tunaimba hapo. Kiswahili Kitukuzwe. Achana hizi zingine zimeletwa na juzi za government hizi. Kulikuwa mnyama amechorwa hapo, tausi, si ndio? Hapa kando, then shairi liko huko. And I've been keeping memorizing that shairi since time before. And it is always memorized in my mind through in form of a song. Inaenda hivi. So introduction itaanza. Tulikuwa tunaanza chini ya daraja 11206 ha. Hizo naachia huko. So I need us to go direct to the Shahiri. The title of the Shahiri ni Tausi. Ilikuwa ina manifestiwa in form of Jazanda. Tausi ambaye alikuwa ni ndege lakini ni binadamu msichana ambaye mwanaume alikuwa anamwandikia. So inaenda hivi. Huyu ni tausi kipenzi machoni, watu tamani kumuangalia. Ndege wa maringo ana ndevu shingo, na mazuri macho kumuangalia. Shabash.
Pigia makofi. Makofi yake. Kwanza, ati mimi ni tausi. No, sikumbuki hiyo shairi. Unaikumbuka?
Wanyama, you have confidence. Wanyama ako na confidence, ndio? Na vile mmetunyamazisha hapa, akatufanya hata tunaanza kuenda ati tunaanza tumekuja therapy session, alafu hata wanyama umekaa hapa how many minutes?
2 minutes.
Amekaa 2 minutes.
Hajamaliza.
Hajamaliza?
Yes.
Amesema aje? Ameimba wimbo gani? Ameimba ukimwi ugonjwa mbaya? Tausi. What was the mkutano wa dondoo ulikuwa gaji?
Tausi.
Like how was the entire thing? What was the story behind that?
Shame.
Like what was happening? Tausi amedu? Amekuwa milikimu. And then wanyama. Hata heri ningekuwa na poem yangu. That was short and sweet. Was it sweet? Mmejibamba nyinyi aki watu mko distracted. Lakini ni sawa, tumesema we got you. Sawa sawa. Huko hakuna mtu ataenda home na migraine. Hakuna mtu ataenda akule nini? Akose kukula. Uwashe gas. Uwashe nini? Watu wakichanganyikiwa wanafanyaga nini? Unajua walimu wa physics tukiwa high school walikuwa wanashikanga dasta hivi alafu wanarub blackboard na mkono. Walimu wa physics walipanga hivyo. Ama wanaekelea mguu ya kufunga kiatu juu. Alafu wanafunga yenye iko chini. Yeah, we declare that is not going to be your portion. Sawa sawa. We are waiting for our judges to. We are waiting for our judges. Tunangoja majaji wetu wa decide. That is what we are waiting for.
Yes, tukingoja judges tunaweza ita LC Sam. Akuja atuimbie wimbo yake. Ni mwimbaji
hodari.
Mwimbaji.
Toto yake ni safi. Yeah.
We hope so.
Unajua watu wanaonanga wasanii kama watu wako hobela. Wasanii ni watu wako na akili. Si ndio? Hebu kwanza ukuje utuambie tapoto yako inakaa.
Creation of rhyme.
Tulisome hapa mbele ya watu.
Akuja hadi na lyrics, kama rhythm. Yaani venye kuandika wimbo si rahisi. Ndio?
Yes, this
is your creation, your personal creation. Si copyright. Okay, tuambie wimbo inasema.
Wewe hebu mtoe hapo akunywe tu maji.
Guys. Uko poa?
Poa.
Bwana mmeboeka.
Hatujaboeka. Mimi nani boy jameni? What's happening? Mbona unaongea kama wewe ni Monica, mimi ndio Elsie, sawa?
Naongea hivyo.
Unaongeanga hivyo? Huwezi ongeza base. Ongeza basi.
Naitwa Elsie Sam. I'm a student hapa Chuka.
Ongeza kabisa. Warembo wanakutrust.
I'm a second year student.
Okay.
Niko na ngoma kadhaa kwa YouTube, ni msanii. Nafanyanga rap, pop, bongo. Kama zote except genge tu na hizo album tu. So nataka kuperform ngoma yangu. Ndio naona mmeboeka, nilikuwa nataka watu kama wamejaa but ni sawa, sio? Hope guys subscribe to my channel. Yeah, inaitwa Elsie Sam. Kama utasahau hiyo jina you can search for Chuka University song. Alafu utaona hapo mimi ndo nime-upload. TikTok, IG na YouTube iko hivyo. DJ.
We can appreciate Elsie Sam jameni.
As we continue pia hiyo kaji squad I'm among them. So naweza wa request wakuje ni hype kidogo wanaweza dance. Kajon kina Kibe kina Casey. You are much welcome on stage. Unaweza clap. Clap jameni. Changamke. Hii ni Chuka University song by Elsie Sam.
Hello sema lazima yatatimia. Japo panapomuda. Subra ngawe imefanaka. Ngawa inaumiza. Sisi Chuka twashukuru. Anatujai kukufuru. Roho kwa walimwengu kwenye wanakuwa na huzuni. Alitabiri mama wetu Nabii Jerusha Kainwa. Aliyeishi na kalenda tukawa sote twasubiria. alisema ipo siku tutajipuka mlima Chuka na kutua vigege kutoka pembe zote za dunia. Chuo kikuu chenye baraka, sote tunapendana, darasa na watamani, sara tunaendana, hata michezo kwenye viwanja kunaga kubaki nyuma. Henry Baba Bwana Makamu kiongozi amesimama, hata online mitandao tunavuma, hatushiriki wote, dunia nzima inatujua. Vyuo vingine Kenya tunaibuaga tunagombea, wala tuna mifano, sisi Chuka ndo number 1.
Mwambia tunaweza klabu kidogo. Changamke na wakikuja wapate kuona kujoni, sio? Let's go.
Mazingira yanafana, kwa kila kona tunatulia, hakuna kuweka bando, kanda zipo bure tunatumia. Arafa sikupataga, unaga kubaki sitojua, shule yetu mwendo kasi, mwisho siku tunatoboa. Sekta michezo tena sindo kusema chini ya jua, kandanda tikitaka raka voliboli vikapunieleka, na sisi ni wacha Mungu, mara kimi tumeshikilia, nguvu za devo zimetufanya eti tunategemea. Karibuni sana, uje muione shule iliona dua, na baraka pia, take nabii wetu Jerusha kanywa. Hakuna usherati, ala miadarati, sisi ni wa dhamani, tunapiganga jimu, badala yake tuna misuli. Chuo kikuu chenye baraka, sote tunapendana, darasa na maktabani, sara tunaendana, hata michezo kwenye viwanja kunaga kubaki nyuma. Henry Baba Bwana Makamu kiongozi amesimama, hata online mitandao tunavuma.
Thank you so much guys. Now I request nyinyi wote, naona mko a good number. Na I'm very sure si nyinyi wote mmesubscribe kwa hiyo channel, si ndio? So ukiingia hata saa hii kuna network. Password ya wifi ni @19 uni service. Hiyo uni iko na initials, alafu service haina initials. @19 uni service. Uingia hapo Chuka University, so subscribe to my channel na Mungu atawabariki. Thank you.
Mnataka kudansi?
Yeah.
Kita
Acha nikushow kwanza form ya kutoa shesha kwa poa na twende tunyeka chini na kwa hadi na mimi zetu nasikiza shesha kitu na feel free teka video na post pale TGC jina ni content unapsi ni talent amuka na check amuka na twende down low now tunakuwa mikono juu alafu tuliza pesa alafu walete amuka na jana mwenyewe kwa bangu leo hapa
Malizeni sasa, fanyeni dance ya mwisho. Mfanye dance ya kutoa hiyo na ya tuwezi kufanya, bana nyinyi madansa. Mwacha kufanya vitu za kawaida.
Uko juu ya kana, hapa ndio kuelekea. Fanya bora tuna mafiki meza na kitu kwa kukitu kitaksi na kitu kwa muda au kwa nia hapo ndio studio. Tutashuka tena pandisha tupiga bila kali kama
Yeah, we can appreciate them. We can appreciate them. We can appreciate this model dance. Naweza appreciate kwa wadogo yake waka na waka. Ona mtu hapa na hasira zake za foto. Mtu kuna vile tu anatoa zake, si ndio? So this guy is wild. Kuna kitu anafanya na kidole yake. Na mimi sijui if you are ready to see horror. Mimi sipendi vile kitu anafanya. Nataka atu surprise. Na mimi sitaki kuona. Hebu fanya kitu unafanya. Hebu utakosa focus. Focus hii kwanza. Are you focused? Mko focus. Fanya kitu unafanya. Hebu waone. Inua juu. Unafanya zote. Siliona wazazi wenye wanasikia kulia hapa. What is happening? Hebu kuja hapa, nini vidole zako zimefanya? Nini zote zinafanya hivyo? Hawakusikia wewe. Ama ni poto. Acha nifanye mimi mwenyewe, si ndio? Acha nimfanye sio nikifika kidole fulani anakaeka hapa. Kuja nikufanye. Ni hii. Na nguvu. Nani atafanya hivyo? Tumpatie how much? Sasa nione. Ndio Dr. Kiboro amefika hapa, maybe anataka kupeana pesa. Prof. Hey. Professor. Tunaweza mpatia how much? Mtu mwenye anaweza vunja kidole yake hivyo. Hakuna usiogope, hakuna mwenye anaweza fanya hivyo usijali. Hata upewe wani mwenye. Hakuna mwenye anaweza fanya hivyo. Usiogope. Aya. Prof amesema mwenye anaweza kufanya kidole yake hivyo analipua bili ya hospitali, hakuna shida. Na anaenda anachinjua poto yake venye anataka. Ya mtu anaweza jitokeza. Hata mkokumi hakuna shida, si ndio Prof? Prof amesema hakuna shida. Hata adjust poto yako vile unataka, bora ufanye hivyo. Hakuna shida. Kwani nyinyi watu si majenzi? Na vile majenzi wako fia suku nje, what are you? Millennials. But you can appreciate that guy. But don't try that at home. Sawa sawa? Hizo si mambo ya kufanya na kila mtu. Sawa sawa? I want us to appreciate Dr. Linity as she comes. You can appreciate her. Yes. We can appreciate Daktari better. Ameshtuka ile anashangaa kama ataweza kuongea saa hizi. Alafu anatulia hapo mtena, alafu anatulia ati hamjambo. Tuna jambo, tuna mambo. What is that? Unakuja kufanya hapa mbele ya watu. Na anaweza kuona poto lake mbele inakaa juu, anaweza andika aje. Anaweza andika hivi akiingia tension kidole igeuke na huko. Si ndio? And we can appreciate Daktari. Karibu.
Thank you so much, the MC. I hope where we were, we have enjoyed the debate. We were here and it was hot, and we really appreciate the debaters. At this time, I want to invite in the house we have our faculty dean, and I want us to invite him on the stage so that he can give some remarks. Can we stand and clap for him as he comes, please?
Thank you. Thank you very much. Asanteni sana. Asante. Yeah, I thank you so much, Dr. Lenity. Let me say my greetings to you first. Then perhaps I will say a few things about the event that we're having today here at Chuka University. And I'd like to start by recognizing the presence of the President of Kenya Economics Students Association, Mr. Victor Kimwamu. We have economics lecturers from various universities. Some of you are serving as the patrons of the Economics and Statistics Club in the various universities. And I would want to start with the patron of Tharaka University, Madam Vivian Lebo, a patron of Econistat, the University of Embu, Mr. Jerry Sumba, the patron Ecostat, Chuka University, Madam Miriam Thuo in absentia, but represented today by Mr. Samuel Irongo. I've seen my colleague Dean from School of Law, Dr. Wycliffe Otiso, fellow lecturers, judges, students. Good afternoon. My name is Professor Christopher Kiboro. I am the Dean Faculty of Humanities and Social Sciences, where the Economics and Statistics Club at Chuka University is domiciled. I have gone through the program. I know you had asked me to request the management to be present today, and I want to convey the apology today. Even me, the reason as to why I have joined you a bit late is because we had a Senate meeting. But the Vice Chancellor has an international assignment, and he conveyed his blessings. He asked me when I come to tell you that he is happy that this function is taking place at Chuka University, and you have his blessings. The two DVCs have also expressed the same message. They would have really wanted to be with us, but because of some official duties, they have asked me to pass their warm greetings to you. I hope you have received them. So, as the Dean, I must say I'm very excited that we have a very organized club that is cutting across different universities, a club that is quite vibrant in terms of organizing various events, including debates like the one that we have. And I want to believe that even by looking at the topic, that is good governance is the backbone of effective policy implementation. That topic is quite timely and mind-provoking. In fact, it could not have come at a better time than now. So I want to really congratulate and thank the team that crafted, or rather came up with this topic, because it is governance that determines the progress of the society. And have looked at the various themes that you are debating today, which include devolution, CBC, health, SMEs, Hustler Fund, and all of that. And when I critically look at these sub-themes, they are well aligned with the government of the day. That is the better agenda of Kenya Kwanza government. So I want to believe that since I understand that this debate is being streamlined, it's being streamed live, there are many people out there that are listening, and perhaps through the discourse that you are having, you are contributing towards shaping policy around these issues. So I really want to commend you. I feel at a loss that I did not start really early in the morning, because I would have really loved to be part and parcel of the audience to listen to your arguments, because I know in one way or another, they inform us about the prevailing situation today, and they bring to the fore the various aspects of these issues, devolution being one of them, okay, competence-based curriculum, health, etc. So I know you have quite a tight program of the day, so I don't want to spend much of the time here talking, but mine is to wish you well and encourage you to even be doing this more often, because there are many benefits that come by debating issues. One of them being that you even improve on your communication skills, you improve your critical thinking, all right? In a way, you discover other talents, including social networking. These are some of the immediate benefits that you get from these kinds of events. So mine is to encourage you, especially the chairs of the various universities that are here of economics and statistics. I think mine is a pat on your back and they tell you, together with your patrons, that you are doing a great job. All right? And so never stop at this. I want to believe this is not the last debate that we are having. And I know you have been traveling to other universities. I'm sure those who are from other universities, our students from Chuka University have visited you. And if they have not, trust me, someday when you organize an event like this one, they also join you to make your event successful. But I want to challenge you, don't just focus on debates only. There are many other things. Now you have demonstrated that you have matured as a discipline. And now these are two disciplines that are coming together, economics and statistics. Perhaps you can even organize a joint conference to discuss these important issues and shape the policy direction of this country around these issues. So this is a challenge. I know you are very, very forward-looking group, and therefore I am very hopeful that you are going to achieve even a lot more. So with those many remarks, on behalf of the university management, especially the Vice Chancellor, I know you were expecting this to come early before you started, but I can say the debate is officially open. So thank you so much. Thank you so much, and God bless you. You're the president. Congratulations. You're doing very well. That level of organization is what we expected from young people like you. Asante, thank you very much. Asante. Dean, this is nice. Yes, Asante sana. Yes. Hey. Thank you.
Thank you so much, Prof, for finding time to come to talk to us, to address us. For sure, we are happy to have you in the house, and we wish that at least if you can wait for the semi-finals, not the finals. Just listen to these students. They have great ideas. For now, we want to announce the people who are going to the groups that are going to proceed for semi-finals. From the two groups that we had, we have come up with the number 1 and 2, and then after that, those are the ones to prepare for semi-finals. Then after that, we are going to have the finals, and then we know the winner. We are going to have number 1, 2, and 3, who are going to get at least some appreciation. For now, I want to say that before we do that, we are also going to pray for lunch. Then we have lunch, and we welcome you also for lunch. We are prepared, these students are prepared for us with lunch. So for now, I will invite my friend who was chairing the other side to tell us the winners, number 1 and 2. They are the ones who are going to proceed with the number 1 and 2 from this other side. Number 1 will debate with number 1, the other side, and then number 2s are going to go with the number 2, the other side. So can I invite Mr. Muthenji to tell us, and Madam Mugure, to give us the number 1 and 2 for the 2 groups. It's okay.
Yeah, so thank you, my boss from economics. And I stand in all existing protocols, and I appreciate our Dean for even joining us, and also the Dean Law. And I'm sure that we will see that the Law School is also doing very well. So from the other side, that we were the group that were down. We had 8 groups that contested in this debate. And from what we have found there is that our students are very good. So from the 8 groups, We had the Ridges, who scored 62%. We had Embu Group, which scored 64%. We had the Titans, which scored 73%. We had the Rakanidi Group 4, which scored 60%. We had Jaba Group. You know that name sounds to Jaba. And they had, yeah, so they scored 81%. So then we had the Rakanidi Group 5, which scored 58%. Phyllis Group scored 55%. The Transformers scored 54%. And therefore, ladies and gentlemen, from that group, I think the result speaks for themselves. The two teams that proceed to the next stage or level is Jaba, which led with 81%. And maybe if I can mention something from that group, it is not the number of people that are in the group. It is the content that is in the group. Jaba had only 3 people. And it's not Jaba, it's Jaba, yeah? So let's appreciate the group again. Then the other group that proceed is the Titans with 73%. So I think that is what we gathered from there. So let's appreciate all the other teams.
Good afternoon once more. From the groups that were here, we had 6. And before I announce those ones will be proceeding, I'll start by thanking everybody who presented. All of you did well. But in every contest, we must have winners and winners, not losers. Because all of us did something good. But before I even read the ones that were proceeding, we realized that some of you had very good presentations, but outside what you were discussing. So if the question is about is CBC properly adopted, please don't tell us the advantages of CBC. Tell us whether what is there already is adopted in the right way or is needs restructuring. Sawa sawa. So let us try to stick within what the topic that we are discussing. Don't move too far away. So we had 6 groups and 2 are going to proceed. And the first one, number 1s, were the Wakili group. They did very well. They had 84%. And then the other group that is proceeding is the group from Tharaka Group 3. So all the best.